And then the last thing I guess is, safety. I've noticed that the device is extremely safe, and the thing that I worry about personally is the wire. So,
Sure.
what kind of precautions do you take? What wire do you prefer? What are some other things that you do to prevent wire perforation or any sort of injury? Because I've never had an injury with the actual device. It's always the only time I've ever seen a complication with the P is from an actual wire issue. So how do you kind of address that, and what do you look for?
No, that's a great question. I mean, I've had a wire perforation, and it was a major complication. It wasn't not related to any device. In fact, we never
Right.
even introduced a device, and it was secondary to a glide wire.
Right.
So I think you do have to be careful when you're utilizing hydrophilic wires. I generally these days try to avoid it at all costs. Basically, what I do with it is I take a pigtail up,
Okay.
kind of shove it in there, and I think you and I probably do things pretty similarly.
Yeah.
Use a 1 centimeter tip Amplatz wire and kind of push it out there and let it kind of form along the pigtail. And at that point, just watching the guide wire at all times
Right.
and put in the device.
Yeah.
I think the other nice thing about the device compared to some other devices out there is that you're doing all the aspiration thrombectomy with the wire in place.
Totally.
I think that makes it safer.
Totally.
You're never giving up the wire, you're not advancing the device without the wire. And because you have a 24 French lumen, the guide wire is really taking up just a very small amount of that space.
Right.
If you try to do that with some other devices out there, the guide wire might end up taking a significant amount of space, and you might not
Absolutely.
get the same aspiration power.
Right. No, I totally agree. And I think the dilator helps a lot too. With
Absolutely.
the fact that there's a dilator helps prevent some sort of complications because, I've yet to see any, and you can probably speak to this, but in the flash registry, the adverse events from device-related adverse events, what was?
Yeah, I mean they were exceedingly low.
Right.
Yeah, I mean the in terms of adverse events and mortality.
Right.
I mean the numbers that really struck me was mortality in the flash registry. We're looking at
Best that's been reported.
less than 1%.
Right.
When you compare it to the PERT database, just to put things into context, there's
Sure.
about 10%.
Yeah. Well, no, I think it's an exciting new. I think it's an exciting new venue and an exciting new frontier in the treatment of PE, and I think this device is really, like you said, to me, it's been a game changer as well. So, just really excited to see where we go from here. So, thank you so much for spending the time with us, and looking forward to hanging out with you the rest of the conference.
Likewise, thanks, Andy.